So good day, good morning, good afternoon, good evening, probably even good night to everybody here. Very welcome to the first Global Community Health Workshop, which starts today on the 6th of July, 2021, and will last 3 days. We're very, very happy to have this event starting, where we're going to focus on community health and the diversity aspects in theory and practice. And today is day one. The theme of the workshop today is community health as a practice. And we're very happy to have you all here. And there will be more people joining. As I said, we have 210 participants, which is, I can tell you honestly, way beyond what we dreamed of. And we are very excited that community health is so much interest in. And I think by definition already, the diversity shows by you coming from your part of the world, joining in this event. My name is Buijs. I come from the Netherlands. I am the manager of the UNESCO Chair, Global Health and Education, and I will be your moderator for the upcoming 3 days.
Thank you very much, all of you, to be here today and for the next 2 days. This is a very, very important meeting for us, for the UNESCO Chair, but also for many practitioners, of course, researchers, stakeholders of community health, because we're going to share what is the real nature of the community health from the different continents, from the different countries, based on our different cultures and practices. Just because it is timely. It is timely to move from a vision of community health shaped by few people to a vision which is based on what we are all doing, the real, actual practices of community health. And this is what we're going to share. And this is what we're going to learn. And this is the very mission of the UNESCO Chair. Most of you know the UNESCO Chair, which mission is to share and produce knowledge production and sharing, and contributing to building a community of actors, whatever their stages. And this community health meeting is one of the milestones of this building of our global community, because community health, it's us here and the people with whom we work. And we are very happy to welcome you for this meeting. And you know, we are not only expecting your attend the meeting, but you contribute, because the richness of what we're going to share is clearly a treasure. But this is not a classical treasure, you know, because this is a treasure that is all the greater for being shared. And then I think this is part of a process of probably trying to enrich what is our vision or understanding of a community health by exchanging experience, information, ideas at the global level. So this is where we are. We not only need you to listen, but also to contribute. And you all know that at the end, everybody gonna have a certificate saying that it's not only taking part to the meeting, but it's also contributing to the global community of the people committed in community health, health promotion, and in general in public health and in related fields. So thank you very much for being here. On behalf of the UNESCO Chair, I really would like to welcome you and to greet you, and I hope it's your turn now.
Yeah, hello everyone. Welcome for this first edition of the Global Community Health Annual Workshop. We're very excited, I must say. It's such a nice thing. I mean, seeing you there joining us, I mean, after all those months of preparation. So I'm Eric Breton. I'm an assistant professor at the French School of Public Health, and I'm talking to you from my office in the French city of Rennes. So it's for me, it's a great day for community health, a great day because we answered our call with much enthusiasm and without knowing so much about these 3 days, what they will actually bring to you. And it's a great day for community health as by coming together, we are actually showing the world our belief in the importance and essential role that play community health, be it in improving the health and well-being of population, and in tackling, of course, social inequalities. So yet, and as you already know, community health for community-based work is too often undervalued and underfunded by our governments. It is also attracting too little interest from researchers, research institutions, and research funding agencies. Often, and this actually leave practitioners on their own for what regards experimenting new ways and strategies to promote health. And this lack of legitimacy and interest is one of the reasons why we decided to organize this global workshop. The conversation with Didier Jourdan, and I'm very grateful to him for actually accepting to work on this idea with me and our colleagues. This idea we had this idea in 2018, and by the end of 2019, we had the main elements of the project, thinking that 2020 would be the year of the first edition. Obviously, the pandemic decided otherwise, but more specifically, we wished with this global workshop to enhance the profile and the recognition of the critical importance of community-based intervention and program. We want to improve the training of a new generation of community health practitioners and researchers. We want to help people back their practice with more science. And we want also to develop the capacities in community-based research by contributing to new conceptual approaches and methods. And we want to be able to identify emerging complex problems, then we can all work together. And of course, we really wish to develop a network of practitioners and researchers joining us in contributing to the missions of the UNESCO chair. And as you can see from reading our program, in organizing the workshop, we tried hard to be up to the values we hold dearly. First, we did all we could to make the workshop as accessible as possible to participants from all continents. And we are very much aware that some of you are in the middle of the night, some of you are very late in the evening. That's what we could do. I mean, there was very little room to adjust the program so we can actually cater for all people's time zones. And we made sure that we would all benefit from your contributions. I include myself, and all my colleagues are including also themselves in gaining from this workshop. It is clear for us that solutions to our current challenges cannot be only developed at the top. There's no way we can actually improve population health with just plans from people from above, I mean, in high-ranking officials, let's say. And we pledged to adopt a social justice perspective. And this is visible in the way we recognize the critical role women in practice and research play in advancing community health. Are we still on air, Ruth?
Yes.
Yep. Okay. Sorry.
Yeah, sorry.
Strange.
Yeah, something happened, but it's over. Yeah.
Very well. Okay. And so, yeah, the fact that it's visible that we try to be open to a very diverse set of people. And we tried as much as we could to recognize the critical role women in practice and research play in advancing community health. I mean, it's visible as well in our program. We also tried to give as much voice to the global south, And we hope, and actually we hope that over the years, contributions from colleagues from the Global South will gain even more visibility in our program. It's a matter of network. It's a matter of getting in touch with you if you live in this, I mean, somewhere in the Global South. And as you said, the theme for this year is learning from diversity in community health practice. We felt that the first step to develop our network of community health practitioners and researchers was to get an overview of the broad spectrum of practices and perspective. Obviously, we won't, I mean, it's not possible to have a very, I mean, diverse view of that, but we can make a step forward in achieving that. We hope this will help us better know and understand each other. That's the real idea. And the lectures, case studies, and testimonies you'll find in our Voices from the Field series will definitely contribute to initiating us to this diversity. But so will you will also contribute in giving us a better idea of this diversity by basically joining the discussion and taking an active part in our satellite sessions. The satellite sessions, as you know, are run on a daily basis and in 4 different languages. We'll have more languages as we'll have the next editions. And I'm really looking forward to listening to you. And so how one can describe our global annual workshop, because that will be, you'll be asked to describe what we've been doing over the past, over those 3 days. Obviously, it will be easier to do so once we can look back at the 3 days we've spent together. But let's say for now that the workshop is about creating a space where people from all over the world can connect with each other to share their experience and views on community health practice. A space where we can find solutions to improve the standing of the field and also new strategies to improve population health and well-being. It's a way for all of us to find strength and inspiration because we are all in together and we are all an important piece of this broad network. So this is why I say that it is a great day for community health. So many thanks for joining us and many thanks to the organizing team that was introduced by Goof. I want to also say, give thanks to a word of thanks to Ashfake Buno, who's also contributed greatly to that, and to all our contributors. And so thank you, and I wish you a very enjoyable 3-day with us.
Thank you.
So hello to everybody. I'm very happy and very honored to participate in this online workshop opening session for at least 3 reasons. The first one, it is an illustration of potential cooperation between UNESCO and EHESP School of Public Health. We all know how tight are the links between education and public health. And I hope that this will be a beginning of useful common projects between us, and particularly with Didier Jourdan and its UNESCO share. We also need to cooperate and more with the International Union for Health Promotion and Education, and I'm very open also to foresee what could be the cooperations. The second point is the subjects of this workshop, and the subjects are really notable and really interesting. Developing community health as a practice, mobilizing communities and promoting health and well-being are fundamental for if we want to expand, to improve, to enhance health promotion and locally and as well as globally. And finally, because I don't want to be too long, because I know that you have a great program, it is 3 days. Finally, this pandemic illustrates how we need to open other perspectives than a top-down approach, which is now predominant. We have to promote individual and collective empowerment, but how to do so? What could be the results or the benefits of such an approach? How can we evaluate this? I'm sure that you will discuss these issues during the workshop. So I would like to wish you a very fruitful 3 days workshop.
Hello, and welcome to the summer course on community health. Thank you as well to the organizers for inviting me to say a few words on behalf of the International Union for Health Promotion and Education. I'll start just by saying that we've had the opportunity to see firsthand the importance of health promotion action at the community level over the past few months of this ongoing COVID-19 pandemic. We are involved in a joint project with 4 African countries and more recently India, where we do some risk communication and community engagement, and it proved very important to ensure that accurate, culturally appropriate information and training were available to marginalized communities in very different contexts, and it made us appreciate the importance of this kind of intervention with a health promotion focus in a context of crisis as well. So this information on this project is available on our website, but we look forward to disseminating it more broadly once the project is fully completed towards the end of October. The mission of IUHPE, which I've been asked to talk about a little bit as well, is broader than this. And if you'll allow me, I'll just share a short presentation with you. So what you're looking at here is the result of an exercise by our executive board under the leadership of our president, Professor Margaret Berry. So this summarizes the strategic orientations for IUHPE for 2021 through 2026. And you see that at the heart of the mission of the organization, there's really an intention to strengthen health promotion systems. And this systemic perspective is very important to us, and we think it's the only way to really have a broad reach and to progress on the strategic priorities that we've identified. And there are 3 of those. So the first being determinants of health, which includes planetary health, because it's becoming clearer and clearer that the health of our natural environment is a very important determinant of human health as well. And also, this includes supporting the achievement of the Sustainable Development Goals, which are in and of themselves, in I think all cases, determinants of health as well. So that's one key priority. And the second one is to address global health challenges. And we've identified 2 health challenges that are current and could be addressed more explicitly and better by a health promotion perspective. One being mental health and well-being, and the other being non-communicable and communicable diseases. And these 2, as we've seen also over the past year or so of the pandemic, are very much intertwined, because what we saw was that people who tend to suffer the greatest consequences in terms of their physical health from COVID-19 are people who tend to have chronic conditions as well. So these 2 challenges and the way that they work together were important for us to address. The third strategic priority is developing the health promotion field. So what we mean by that is to ensure that as a global community, we continue to facilitate the sharing and generation of knowledge and expertise, and that we also facilitate capacity building for health promotion globally. So to continue to support the development of health promotion competencies that make a unique contribution to the health challenges that are happening around the world. So those priorities are supported by operational measures, which you see here, and I won't go through all of them in detail. I think you can see just by reading them how they might be helpful in making sure that we advance on our priorities and our central goal in an efficient and effective way. And of course, and this isn't explicitly written here, but it's part of the document, all of this is really to support equity in health. So that's the mission overall, and we invite you to join us in this mission and in this range of actions by becoming a member of IUHPE. And we also invite you to join us next May, in May 2022, for the 24th World Conference on Health Promotion that will be held in Montreal. I can pull up this slide. The call for abstracts is currently open and will be open until mid-September. So please feel free to submit your abstracts. Now, for now, have a wonderful 3 days of learning and sharing, and thank you again.